Hi, this is Dr. Weirs. Speaking about thyroid, so thyroid is actually a lot more difficult subject than I was taught when I was in medical school. Still to this day, I think many doctors are taught to only look at certain labs like the TSH and T4. We now know that doesn't give you the complete picture of what's actually going on in the body. And also we know now that the blood levels are really just a reflection of the blood levels. They're not really telling you what's going on at the receptor in the cells. In addition to that, these days we know that there are several chemicals, common everyday exposures that most of us are being exposed to, that can actually interfere with things. They're endocrine disruptors. And so when we're actually approaching a thyroid patient, we're usually going to approach them, number one, clinically, because it is a clinical diagnosis. So if the patient has all the signs and symptoms of hypothyroidism or hyperthyroidism, that actually means more to me than just what the labs are saying. We still use the labs. I've been happy with using the total T3 divided by reverse T3 ratio to give me a number, and when that number is within the optimal range is when most people are actually reporting that they feel their best. But again, all these things I'm going to take into account, and I've been amazed lately at the epidemic of hypothyroidism that we're seeing and how it just seems to be ubiquitous. And I think there's many reasons for this right now, but it is a very, very common and expanding issue at this time.